My name is Elizabeth Yost. I am a nurse. I am Director for Supply Chain at Children's Hospital of Michigan. I have been working at the DMC for 15 years. One thing that makes my nursing career so fulfilling at the Detroit Medical Center, Children's Hospital of Michigan, is being able to be the voice of the patient. We take care of children, and a lot of times the parents are concerned, worried, scared about what's going to happen with their child, and it's up to us to be able to ask the questions that maybe they don't know or can't think of at that time. And I think it's such a huge honor to be able to be that person for them, and it's definitely not lost on me. So the DMC, Children's Hospital, has been able to give me a lot of opportunities as a nurse. I started as a student nurse at Huron Valley and came to Children's because I knew my heart was in pediatrics. Was a floor nurse at bedside on a general pediatric floor. I was able to then go to the emergency department, which led to a lot of other opportunities, one being helping build a new addition to the hospital, and that sent me into nurse leadership. And from there I was able to look at different areas of the hospital. I was able to then become the Director for Supply Chain. I think the greatest thing about each of those roles is I still felt very much a nurse, even when I was not at the bedside, but also the common goal of taking care of our patients and our families and getting them what they need. The culture of Children's is family, I feel. I've worked here for quite a few years, and one of the biggest things was the ability for me to come in, even if I'm having something, a rough day at work or a rough day from home. They're there to pick me up, but then we get to celebrate those great moments too. And it definitely is a sense of community and family when I come to work. I knew I made the right choice coming to the Detroit Medical Center. When I worked at Huron Valley as a student nurse, I would go to the women's health unit often, and it was there seeing how the nurses cared for the patients and their families and really just explained to them what was going on and ease their fears. That made me realize that even though I didn't want to go into adults, I wanted to stay within the Detroit Medical Center, and led me ultimately to Children's. For anyone who's thinking about working at the Detroit Medical Center, I would say do it. I love working here, and I think that we have such a vulnerable population here, especially at Children's, that there's so much good you can do. I know coming into work, I'm leaving work every single day, I love it. I feel that we make a huge difference in the patients we care for, but also in our colleagues. We are there for each other, and we really want everybody to be happy and successful in whatever they choose to do.